Hello, Farrell Pediatrics families. It's Dr. Kapoor here. As we enter into 2021, Dr. Marr and I are here to take a moment to review our COVID safety protocols, as well as remind our families about the importance of keeping up with your child's annual wellness visits and vaccinations. Okay, first, let's talk about safety. So we're going to start talking about COVID and some of our safety protocols. So far, 2021 has brought us our highest COVID numbers yet in Northern Virginia. It has also brought us vaccinations against COVID. Although there appears to be a light at the end of the tunnel, we must continue to be vigilant. We at Farrell Pediatrics continue to keep the safety of our families and staff at the forefront during this challenging time. So listed here are some of our safety measures. We are continuing with our car to room option. We have air purifiers in every room. We have strict cleaning protocols between every visit. Well appointments are reserved for the morning hours. We have a separate entrance for those who come in with fevers and potential for COVID-19 infection. So, what do you do if your child has a fever or you think there might be a potential for a need for a COVID test? We set up appointments in the afternoons for our patients who have fevers to be seen and tested, evaluated, and potentially tested for COVID. When your child is ill and there is this potential, your child will get an appointment in the afternoon and will be instructed to go to room 8. We ask that you call when you get to the parking lot, and you will be asked to wait in your car until you are ready to come up. You can enter when you come up to the 4th floor through the first door to our office. You will see a sign that says room 8 assignment, enter here. Room 8 is this, when you walk into the office, room 8 is the second door on the left. And you can walk into the room even if the door is closed, where when you come in, you will be greeted by our staff. We typically have a nurse and a physician in the room in full PPE for everyone's safety. We also have a filtration system, as well as supplies for COVID rapid antigen testing and PCR testing, which we can do in our office. If you, the parent, or if there's a parent who is awaiting your own COVID test results because of a known exposure, we ask that you have someone else bring your child to the appointment. During your visit, the physician or the nurse can review current self-isolation and quarantine guidelines, as well as discuss results of any testing that is done in the office that day. I'm sure there are plenty of questions that you all may have, and I want to assure you that we are here to answer all your questions, as well as try to take care of all of our patients in the safest and best way possible. I'm going to turn it over now to Dr. Marr, who's going to talk to you a little bit about the importance of the wellness visits, as well as keeping up with your child's vaccinations. Let's make 2021 safe and healthy for everyone.
Hi, now that we've talked about our safety procedures, we also want to talk about why you should bring your kids into our office. The most important is that it's really important that kids and teenagers continue to have their routine well checkups. We do a lot of things at the checkups, include reviewing growth, which can be an important marker of child health. We also give vaccinations on the regular childhood schedule, and it's really important that your babies and your toddlers, as well as your older kids and adolescents, don't fall behind on their standard childhood immunization schedule. For teenagers in particular, there's several vaccinations that are recommended starting at age 11 and older that we really want to make sure that they don't miss just because of the pandemic. And of course, it's very important for babies not to fall behind so they don't become susceptible to other diseases during this turbulent time. In addition to looking at growth and giving vaccinations, we also will the, address your concerns during the checkup, as well as just evaluate how your kid's doing. A lot of times at the checkup, we may pick up on issues that may or may not have been things that parents and children are aware of. This might include scoliosis in a teenager or a developmental issue in a young child. So the well checkup is really important, and we want to make sure that your child is being seen according to the standard schedule. In addition to um, well care, we are seeing a epidemic proportions of mental health issues in this time. We are seeing a lot of kids struggling with school issues, with learning issues, with depression and anxiety and eating disorders. And it's really important that you know that we are there for you and your children during this time. At the well checkups, we will screen adolescents for depression. And we will talk to your kids about whether or not they are struggling in school and how these things are going. If you know that you're having concerns with these issues, we have appointment times available for consults to discuss with you and to discuss how to make sure that your kid is getting the care that they need. Mental health is really, really important, and we want to make sure that you're receiving the care that you need. If your child is already on medication for a mental health issue or any other kind of chronic illness, we want to make sure that you are getting follow-up care. And so we have appointments scheduled to make sure that the medications are still appropriate, that they are still on the appropriate dose, and just to kind of follow up and see how things are going and whether or not care is being optimized. And so that's another important thing to make sure that is not being missed because of the pandemic. Finally, we all know that kids need support of adults during this uncertain time. It's been a tough year for everybody, and kids often react to the adults around them. We want to come alongside you as pediatricians. We want to come alongside parents and help your kids through this time. Hopefully, we are all hopeful that we are seeing a light at the end of the tunnel as the vaccine has come out. We're all super excited about that. And we hope that things are going to start to normalize for our kids. But as we've said, it's been a tough time for adults and for kids and for families in general. A few tips of things that can help would be limiting media exposure, making sure that your kids know that they're safe and that you are always available to talk to them about things that they are going through. And also to share with your kids honestly when you are stressed and what things that you might do to to help yourself when you're stressed. So for me, that might be something like going on a walk or watching a silly sitcom as a family or painting my nails or just taking some time to de-stress a little bit. And I help my kids find things that they find helpful when they are stressed as well. Um, so we are certainly want to be available to your kids during this time for both their normal well care as well as mental health issues, as well as any other sick visits or other things that might arise. We want to make sure that their health is still being taken care of, and we want to help you as a parent to support them during this time. We hope to see you in our office soon.